And so all of our systems and tools and strategies are based on human behavior. So I guess the best way for me to explain this is this. If you know why people do what they do, if you know how people make decisions, then you're in a much better position to actually implement marketing strategies and systems and use the tools that are going to take advantage of that knowledge. One of the first things that we tell people at the beginning, or I tell people at the beginning of the Mass Referral Seminar, is very simple. Number one, I have to believe, and I do believe, that every person who registers for the Mass Referral Seminar is of the highest ethical standard. In fact, when anyone registers for our event, we do essentially what's called a background check. Why are we doing that? Because the information that I'm teaching you at the Mass Referral Seminar during this first hour, this information can be used for good or bad. And what do I mean by that? The information is incredibly powerful. We're going to be giving you tools that will allow you essentially to get people to do, and the people I'm talking about are not only the patients you have, but your employee. You're going to be given tools that allow you to literally direct the behavior, the actions of those people. You're in a very honorable profession. You're a dentist. So what you're providing for your patients and what you're providing for the people in your community is good, it's honorable, it's dignified. One of the qualifiers that I use before I go through this information is very simple. If in fact I find out that you're using the information that I give you or using our system in a way that you're recommending care and treatment for patients that's really not in their best interest, you're looking essentially to line your pocket. And those people will be terminated immediately as far as their relationship with me. And certainly I don't want to work with anyone who's going to do anything that's not of the utmost level of integrity.
Nancy, Dr. Chapman here. Would you be so kind as to escort our new patient back to the office? Yes, that's right. She was referred in from Mary Smith. What's that? The new patient just scheduled her husband and her 2 kids. How delightful. I'll be sure to thank her for her confidence in us when you bring her in for the exam.
Good morning, Dr. Chapman. It's a pleasure to meet you. Mary has told me so many good things about you. And I just watched a video in your reception room. I was delighted and comforted by all those patients of yours telling how wonderful it has been to have you as their dentist.